First, we'll discuss thyroid disorders such as hypothyroidism and hyperthyroidism, their causes and their treatment. So, let's start from hypothyroidism. What are the causes of hypothyroidism? The most common cause of uh, hypothyroidism in UK and in Europe is autoimmune or Hashimoto's thyroiditis. So, autoimmune thyroiditis, such as Hashimoto's thyroiditis, is the most common cause of hypothyroidism in developed countries. And dietary iodine deficiency is the most common cause of hypothyroidism in developing countries or underdeveloped countries. Some of the less common causes include subacute thyroiditis and renal thyroiditis. Subacute thyroiditis such as decurvin thyroiditis and renal thyroiditis are less common causes of hypothyroidism. Similarly, a patient can develop hypothyroidism after thyroid surgery, such as thyroidectomy, or after treatment with radioiodine. So, in short, the most common cause which you need to remember is Hashimoto thyroiditis, and the most common cause in Africa and developing countries is iodine deficiency. Less common causes include subacute thyroiditis such as decurvin thyroiditis and renal thyroiditis. They are less common. And similarly, a patient who undergo thyroidectomy or radioiodine treatment, they can also develop primary hypothyroidism as a result of treatment with radioiodine or due to surgery. So, what is primary hypothyroidism? In primary hypothyroidism, there is decreased production of the thyroid hormone. And we all know that thyroid hormone is synthesized and secreted by thyroid gland. And the hormone that is responsible for the stimulation and excretion of thyroid hormone from thyroid gland is that is released by the hypothalamus, which is thyroid releasing hormone. So hypothalamus releases thyroid releasing hormone, which stimulates the anterior lobe of pituitary gland to produce thyroid stimulating hormone, and then thyroid stimulating hormone stimulate thyroid gland to produce thyroid hormone. So remember this axis: TRH or thyroid releasing hormone from hypothalamus. It stimulates the pituitary gland to produce TSH, thyroid stimulating hormone, and then thyroid stimulating hormone stimulates the thyroid gland to produce thyroid hormone. So the primary hypothyroidism is decreased production of thyroid hormone due to a disease of the thyroid gland such as Hashimoto thyroiditis, subacute thyroiditis, renal thyroiditis, or iodine deficiency. While secondary hypothyroidism means decreased production of thyroid hormone due to less thyroid stimulating hormone or due to thyroid stimulating hormone deficiency. So hypothyroidism due to thyroid stimulating hormone deficiency is secondary hypothyroidism. And as I told you that thyroid stimulating hormone is secreted by the pituitary gland. So any pituitary disease such as pituitary neoplasm, infiltrative disease or infection of the pituitary gland can lead to secondary hypothyroidism. Secondary hypothyroidism is very rare. Just remember its definition and its causes just for your knowledge. You will be asked about primary hypothyroidism in Plab 1 exam. Now there is another type which is tertiary hypothyroidism. Tertiary hypothyroidism is basically due to problems in the hypothalamus. So if there is problem in the hypothalamus, there will be low TRH or thyroid releasing hormone from the hypothalamus, and then we will call it as tertiary hypothyroidism. What are the clinical signs and symptoms of hypothyroidism? Hypothyroidism is a hormone that is responsible for different metabolic functions of the body. So a decreased thyroid hormone or thyroxine will lead to weight gain because of excessive fat deposition, bradycardia, constipation, cold intolerance, menorrhagia initially and then amenorrhea, tiredness, hoarseness of voice, dementia, dry skin, goiter, and raised cholesterol. So all the metabolic functions of the body will be decreased. Decreased metabolism of fats will lead to weight gain and depression of other systems such as cardiac depression, GIT depression, and due to low metabolism or slow metabolism, cold intolerance, menorrhagia, because menorrhagia and amenorrhea occur in hypothyroidism because when thyroxine hormone is decreased, then due to feedback stimulation, thyroid releasing hormone is released from the hypothalamus. Thyroid releasing hormone from hypothalamus stimulates the pituitary gland to produce two hormones. One is thyroid stimulating hormone and the other one is prolactin. So thyroid releasing hormone from hypothalamus stimulates the production of two hormones from pituitary gland. One is TSH, thyroid stimulating hormone, and the second one is prolactin. And prolactin inhibits the gonadotropin releasing hormones such as FSH and LH. Due to inhibition of these two hormones, there is menorrhagia initially and amenorrhea in the later stages of hypothyroidism. Decreased mental function will lead to dementia. Now, some signs of hypothyroidism include dry, coarse skin, hair loss, cold peripheries, puffy face, hands, and feet. So, these are some signs and symptoms of hypothyroidism. An important thing to remember that hypothyroidism is associated with amenorrhea. Amenorrhea and high prolactin levels. Why there are high prolactin level in hypothyroidism? Because decreased production of T3 and T4 leads to a release of thyroid releasing hormone from hypothalamus, which stimulates the pituitary gland to produce TSH and prolactin. So there will be hyperprolactinemia, which will lead to high prolactin level causes a decrease in the production of FSH and LH, due to which patient will have initially menorrhagia and then amenorrhea. In Hashimoto thyroiditis, patient will have features of other autoimmune diseases such as vitiligo, pernicious anemia, recent disease, and diabetes mellitus. Now, the management of hypothyroidism is levothyroxine. Levothyroxine is normally started at a dose of 50 to 100 microgram OD, while in elderly patients and those with ischemic heart disease, Levothyroxine is started at lower doses, such as 25 microgram OD, and then it is slowly increased. And thyroid function tests are repeated after 12 weeks or after every 3 months. And the disease monitoring is done through a TSH level. And the treatment goal is to aim at TSH value of 0.2 to 2.5. What are some side effects of thyroxine treatment? Patient with angina will have symptoms increased. This is a side effect of thyroxine treatment. Thyroxine treatment or over treatment with thyroxine can lead to atrial fibrillation, and also it can lead to hyperthyroidism as well. And as thyroxine stimulates the bone resorption, so high level of thyroxine can decrease the bone mineral density as well. And remember that iron supplementation reduce the absorption of levothyroxine. So if someone is taking iron and he started on levothyroxine, then you need to advise him to take them at least 2 hours apart. So this was all about hypothyroidism, its causes and its management.
So, which one to take first, the levothyroxine or iron medication? Like in like a two,
Does not matter whichever you take first.
but
You just need to take them 2 hours apart,
okay,
because in 2 hours one drug will be absorbed and then the other drug will be taken, because the iron reduces its absorption. That's why we need to give a 2 hours break between these two drugs. So a short summary of hypothyroidism: the most common cause that you need to remember is Hashimoto thyroiditis in developed countries or in UK, and iodine deficiency in Africa. The other cause that you need to remember is radioiodine treatment and thyroidectomy can also lead to hypothyroidism. Secondary hypothyroidism is due to problems in the pituitary gland, and tertiary due to problems in the hypothalamus. Uh, what will be the investigation finding in case of hypothyroidism? Because there is a decreased production of T3 and T4 due to autoimmunity. So low levels of T3 and T4 on thyroid function test will be found. Because T3 and T4 are low, they will stimulate the production of TSH from the pituitary gland through a positive feedback mechanism. Low level of T3 and T4 will stimulate the production of TSH from the pituitary gland. So in primary hypothyroidism, T3 and T4 will be low and TSH will be high. While in hypothyroidism, there's problem in the pituitary gland, but it's still hypothyroidism. So T3 and T4 will be low, and thyroid stimulating hormone will also be low, because the secondary hypothyroidism is basically due to a decreased TSH. So low TSH, low T3 and low T4, our diagnosis will be secondary hypothyroidism. In primary hypothyroidism, T3, T4 will be low and TSH will be high. Is this point clear to everyone? I'll take the silence as a yes, that this point is clear to everyone, that in primary hypothyroidism, T3 and T4 will be low and TSH will be high, while in secondary hypothyroidism, all three of them will be low. Low TSH, low T3 and low T4.
So why TSH would be low in secondary one?
What is secondary hypothyroidism? Secondary hypothyroidism means hypothyroidism due to pituitary diseases.
Right.
So pituitary disease will lead to a decreased TSH.
Okay.
Basically, in secondary hypothyroidism, the decreased production of T3 and T4 is due to low level of TSH due to some pituitary disease. That's why TSH will be low in secondary hypothyroidism.
Right.
The management of hypothyroidism is levothyroxine 50 to 100 microgram once daily, and patient with ischemic heart disease and elderly patient, uh, levothyroxine is started at 2.25 microgram, and TSH levels are measured every 3 months or 12 weeks, and the target goal is between 0.5 to 2.5 micro unit per liter. Side effect of thyroxine treatment is the patient can develop atrial fibrillation, patient can develop hyperthyroidism, and decrease bone mineral density because thyroxine or thyroid hormone increases bone resorption. One other thing that you need to remember is that thyroxine absorption is decreased by iron, so they should never be taken together. Congenital hypothyroidism, what are the features of congenital hypothyroidism? Hypothyroidism that is present at birth is called congenital hypothyroidism. Congenital hypothyroidism will cause jaundice, or the baby will have goiter. Congenital hypothyroidism can also cause uh, in in babies in reaching delay in reaching their normal milestones of development with a short stature and coarse features. What will be the coarse features? Protruding tongue, broad flat nose, widely set eyes, and sparse hairs and dry skin. Remember that thyroid hormone or thyroxine stimulates the growth of hair follicles. So in hypothyroidism, the hair will be sparse, and thyroid hormone also causes a deposition of subcutaneous fluid, glycosaminoglycans, and mucopolysaccharides. So a deficiency of thyroid hormone will result in a dry skin. Also, mental development will be decreased because of decreased metabolism, epiphyseal dysgenesis, and delayed dentation. So in short, the features that you need to remember for the diagnosis of congenital hypothyroidism is jaundice, protruding tongue, broad flat nose, widely set eyes, and sparse hair and dry skin. So Hashimoto thyroiditis is the most common cause of hypothyroidism in UK. It is common in it is 5 times, or it is 10 times more common in women. Hashimoto thyroiditis usually present with features of hypothyroidism that we just discussed. Remember that the antibodies that are present in the Hashimoto thyroiditis are anti-thyroid peroxidase antibodies and anti-thyroglobulin antibodies. So this was all about hypothyroidism, its causes, and its management. Is it clear to everyone up to this point?
Yes.
Okay, now some causes of hyperthyroidism. Hyperthyroidism, the most common cause of hyperthyroidism is Graves' disease, and a less common cause of hyperthyroidism is toxic multinodular goiter. So, what is Graves' disease? Like Hashimoto thyroiditis, Graves' disease is also an autoimmune disease. In Hashimoto thyroiditis, the antibodies that are produced are anti-thyroglobulin antibodies, while in Graves' disease, the antibodies that are produced they resemble TSH or thyroid stimulating hormone. Thyroid stimulating hormone is also known as thyrotropin. So, in Graves' disease, antibodies are produced that resemble TSH. So, their function just like TSH. The function of TSH is to stimulate the thyroid gland to produce T3 and T4. That's why Graves' disease causes hyperthyroidism, because the antibodies that are produced in Graves' disease are just like or they resemble TSH. Because there is increased production of T3 and T4 due to TSH resembling antibodies. So high level of T3 and T4 will suppress the TSH levels. So the lab abnormality in Graves' disease will be high T3 and T4 and low TSH. Because high T3 and T4 will suppress TSH level through a feedback inhibition. Remember that whenever someone has an autoimmune disease, there is a chance that he or she may have features of other autoimmune diseases such as adhesion disease, vitiligo. So autoimmune diseases such as adhesion disease and vitiligo and diabetes type 1, they can be found in Hashimoto as well as Graves' disease patients as well. In Graves' disease, there is diffuse enlargement of thyroid gland. It is the most common cause of thyrotoxicosis, as it is an autoimmune disease common in women. What are the symptoms that are present in thyrotoxicosis? Some symptoms are specifically present in Graves' disease and not other causes of thyrotoxicosis, such as toxic multinodular goiter. What are those symptoms that are only present in the Graves' disease is acropathy, pretibial myxedema, and eye signs such as exophthalmos, ophthalmoplegia, diplopia, lid lag and lid retraction. So these symptoms, which are acropathy, pretibial myxedema, and eye signs, they are present in only in the disease. So investigation will show raised T3 and T4 and low TSH, while the autoantibodies that are found in Graves' disease are TSH receptor stimulating antibodies in 90% of the patient and anti-thyroid peroxidase antibodies in 75% of the patient. So let's compare it to the antibodies with that are found in the thyroiditis are found in both Graves' disease and in